Here's the way the system works, and it's broken and it's collapsed.
We don't realize how good we have it to have such good, caring healthcare workers in our country. And it's hard to watch that and see so many of them burnt out because of the system. I work in health insurance, and before you bite my head off, I want to be part of the solution. I have some tips that will not solve the problem, but at least create better experiences when you do need to seek medical attention and help alleviate some of the strain on the healthcare workers. The first thing is knowing the difference between when to go to urgent care versus going to the emergency room. Now, this is not medical advice, but this is just some of the things that you could potentially be seen at urgent care for and some of the things that you could be seen at the emergency room for. Knowing the difference beforehand can not only save you time, but money. The emergency room is more expensive than urgent care, and sometimes things can even be treated by your primary care doctor. And even if you're unsure before you go, you can contact the urgent care or the emergency room before you go, and they can give you their advice. And my second piece of advice is don't wait to seek medical attention until you're in an emergency situation. Keeping up with your preventative care is a key factor to detecting things early before they do get to emergency situations. Of course, accidents are unpredictable, but when it comes to your health, having preventative care and not using the emergency room or even urgent care as like your doctor or the only time that you go, keeping up with your preventative care is going to help detect those problems earlier. And a lot of plans have preventative care visits and benefits. So if you have health insurance, use it while you're healthy. It's not just for when you're sick. And lastly, it does tie into not waiting to get health insurance just because you're healthy now. When you're healthy is actually the best time to get health insurance because your rates are going to be lower and you're going to have more access to better plans. You don't want to wait till something happens and now you have a pre-existing health condition that's going to limit your access to health insurance coverages. Again, I know this is not the solution to the bigger problem at hand, but it's something actionable that you can do now to give yourself better health care and help with the burnout that our healthcare workers are feeling. As incredible as our healthcare workers are, they are also humans too. They get mentally burnt out, they get physically burnt out. And I know if you're anything like me and you need to go seek medical attention, you want that provider, that person to be at their fullest. So let's do what we can to be part of the solution when we seek medical attention.